Understanding the cost of full mouth dental implants can feel overwhelming. Every provider seems to have a different price, different process, and hidden fees that can catch you off guard. You want a solution that's effective, affordable, and long-lasting without having to sacrifice quality or looks. But trying to compare options feels difficult when the details aren't always there. Here's something you may not know. Not all dental implant providers follow the same process. The level of expertise and care can vary significantly, and that can impact both your experience and your results. Let's start with something surprising. Any general dentist can take a weekend course on placing implants and start performing surgery shortly after. While many general dentists are highly skilled in their field, implant surgery is a complex procedure that requires extensive training to master. Another important consideration is anesthesia. General dentists typically cannot provide general anesthesia unless they've undergone specialized training and obtained the proper certifications. That means some providers either don't offer it at all, or they require the surgeon to manage both your surgery and your anesthesia at the same time. At Nuvia, we take a different approach. Every one of our locations has a certified oral and maxillofacial surgeon. These specialists undergo an additional 4 to 6 years of hospital-based surgical and anesthesia training right after dental school, making them highly qualified to perform complex implant procedures. But we don't stop there. Unlike many providers who have their surgeon handle anesthesia themselves, at Nuvia, we provide a certified registered nurse anesthesiast for every surgery. And that CRNA's sole focus is keeping you safely and comfortably asleep so your surgeon can focus entirely on your procedure. To our knowledge, no other provider brings together an OMS, a CRNA, and a dedicated restorative dentist for each procedure. This level of specialized care ensures that every aspect of your treatment is handled by experts, all at no additional cost to you. So what does the procedure cost? I'll give you ballpark numbers in a moment, but first, let's talk about what you're really paying for. Traditional teeth-in-a-day providers often place you in a temporary denture the same day of surgery, and you can find yourself wearing temporaries for up to 10 months before you even get your permanent teeth. And there are often hidden costs along the way, like extra fees for sedation. At Nuvia, it's different. We deliver your permanent teeth in just 24 hours. No temporaries, no hidden fees, one all-inclusive cost that covers everything. Extractions, surgery, implants, sedation, and immediate aftercare. And if you're curious about the cost, I've put a free cost guide that can potentially save you thousands right here where you can scan, or you can download in the link in the description. Even though we include more, an OMS, CRNA, restorative dentist, a real permanent smile in just 24 hours, our costs are still lower than many other providers. The national average for full mouth dental implants is around $450 to $900 per month, and our pricing is right in that range. At Nuvia, your safety and results come first. We believe you deserve permanent teeth in just 24 hours and not up to 10 months. And we know this all sounds too good to be true, and only 50% of people who actually watch this video will come in for a consultation. And this breaks our hearts. These are the top 3 concerns we have from new patients. Number 1, cost. What will this cost me? Every patient is different, but we've put together a cost guide to help you navigate potential cost savings. That's in the description below. Number 2, the gap. Your dental implants have healed, but there's a gap in between the implant and your gums. Is that permanent, or can it be fixed? Listen to this patient's story.
Here we are, right there. As that swelling goes down, that gap becomes even larger. Don't be nervous about it. It's just part of it. Because when you go back in, I promise you, Nuvia is going to take care of that. They're going to go in, take new measurements, and they're going to make everything look pretty again. And make sure that what they did was a work of art, because their name is in your mouth now. So every time you smile, you represent Nuvia.
Number 3, pain. Just the word extractions is pretty scary, but the majority of our patients report little discomfort and nothing a little Tylenol or ibuprofen can't handle. Here's what this patient had to say.
The important question was, am I going to be awake or am I going to be asleep? And they said, we knock you out. I was excited. I wasn't going to feel a thing. I was going to be out of it, asleep, like not groggy, not knowing what's going on, not hearing all those sounds, because y'all know what sounds y'all hate to hear when you're at the dentist. This is what sealed the deal right here. And the best thing about it was, not did they just have a prosthodontist and then a surgeon and all of the people that help them with the surgery, they had a dedicated anesthesia person that sat there and monitored me the whole time I was out. I know that can be a little worrisome for people. At Nuvia, you don't have to worry about that at all. They have that person that their responsibility is making sure that that part of your surgery is okay.
Now that we've covered the top 3 concerns, you're going to want the real and the raw about dental implants. For that, watch this video right here.